My name is Sona, and I'm CEO of Neopenda. We're a medical device company innovating technologies to improve newborn health outcomes. When I was in this ward just a few months ago, it was chaos. It was a room maybe half the size, and there were 75 babies and only 2 nurses. One of the nurses was walking around and noticed a baby, a 30-week-old premature baby, had turned blue. They tried to give her oxygen, but it was just too late. This is the sad reality for far too many newborns, because 45 million newborns need care from complications that happen at or around birth. And of those, 3 million newborns are dying every year in the developing world. And the WHO estimates that 80% of those deaths are actually preventable with timely recognition of distress and appropriate treatment. But the problem is, there isn't really an easy way to identify when a newborn is actually in distress. Neopenda is changing that by giving voice to every critically ill newborn that needs immediate attention in low-resource settings. We've developed a patent-pending wearable vital signs monitor that continuously measures 4 crucial vital signs, all in this small wearable device. The vital signs from multiple newborns in the room wirelessly connect to a single tablet, so a nurse can efficiently be able to tell the health status of all of the babies in the room just by looking at one screen. And of course, if any of the vitals go outside of a healthy range, a nurse is immediately alerted so she knows where to direct her attention most efficiently. We know that if a baby is having trouble breathing, giving the right amount of oxygen at the right time could be the difference between life and death. Our vital signs monitor can detect that, so babies like the one I saw a few months ago don't go unnoticed and die from preventable causes. We're starting out by focusing on the 45 million newborns who need our attention in low-income countries. But we can readily adapt our technology to many other patient populations and use cases. We'll first adapt it to pediatric populations in hospital settings, and then create an accompanying mobile application for community health workers and midwives in more rural settings. Combined all together, this gives us a large and untapped market of $715 million US. So what's actually happening right now? Well, nurses are manually measuring the vital signs, going from baby to baby, using the scarcely available equipment, if anything exists at all. Naturally, this really only happens intermittently. Compare that to a high-resource hospital where you'll find many machines created by Covidian or Massimo, for example. We're taking the known and proven science from those monitors and reimagining it for a low-resource setting where there are significant constraints in cost, power stability, wireless connectivity, and maintenance. And in comparison to a single Covidian monitor that can cost upwards of $6,000 US, we can equip an entire newborn ward of 15 beds for less than half of that. There are a few others that are creating devices specifically for low-resource settings, like Bempu and Lifebox. But we are the only device that continuously measures all vital signs necessary for any critically ill baby. So taken together, we really deliver the best outcomes in low-resource settings. We'll sell our devices in packages to public and private hospitals who are increasing their budget for medical equipment. But to really achieve the scale that we're looking for, we'll also sell to NGOs and aid agencies who have a much broader reach. We're currently signing letters of intent with Doctors Without Borders and AmeriCares, who have expressed the intent to purchase devices for the 4,000 health facilities they operate in around the world. And as a for-profit social enterprise, we believe in that double bottom line. Our double bottom line includes improving the quality of care of nearly 16 million patients by 2023, and doing so in a way that generates sustainable revenues of over $16 million by then. We have a really strong team that's leading these efforts, and we're backed by a diverse advisory board and several key partners who have expertise in medical devices, international development, and entrepreneurship. And right alongside our team is a variety of stakeholders that we're excited to have the support from right from the start. Nurse Donnelly has this issue day in and day out, and she can't wait to have her hands on our product. Ministries of Health are excited about what we're doing because it plays into their role of improving newborn health outcomes, particularly in relation to the Sustainable Development Goals. And they're increasing their medical equipment budgets. In 2015, for example, Uganda spent $343 million US on medical equipment and supplies, which is a 46% increase since 2012. And of course, our investors see this as a massive opportunity to pair high social impact with sustainable financial returns. Together, we've been able to accomplish quite a lot since we started. We've been to Uganda several times to really understand the needs on the ground and iteratively design our solution with 150 users from 27 hospitals throughout the country. We've raised over $600,000 in funding, we filed a PCT patent, and we finalized our MVP that we're really excited to be launching into our next steps of clinical trials to assess the accuracy, feasibility, and impact prior to commercialization at the end of next year. But to keep all of this momentum going, we've opened a $750,000 seed round. So we invite you to join us in the fight to reduce newborn mortality. So every baby, including the one like I saw a month ago, has the healthy start to life they deserve. Thank you.